other industries. Instead, our healthcare system leaves its customers walking in blind, all while simply rewarding doctors for doing more. From my earliest days as a medical student, I've wondered why the same patient wheeled off for heart bypass surgery in Houston might simply be given an aspirin in San Francisco. I have long considered it self-evident that good medicine is not location-specific. Best practices are universal. Despite strong evidence that medical procedures should start with checklists, like those that pilots use before flying planes, most doctors did not use them, and to this day many still don't. Similarly, some notable hospitals choose not to staff their intensive care unit, ICU, at night with a doctor. Even more hazardous, a hospital can be well aware of its consistently high complication rate for a service it provides, yet have little or no incentive to do anything about it, leaving the public in the dark about its danger zones. Without publicly available metrics of a hospital's outcomes, how can Americans choose where to go? The only thing most people have to compare is parking. Medicine is competitive, but it is competing over all the wrong things. In the past few years, experts who gauge the quality of medical care have formalized fair and simple ways to measure how well patients do at individual hospitals. These statistics are telling. They identify the good and the bad outliers within a town or city. If you had access to this data, you'd know just where to find the best care in your area. So, why can't you get this information? Because Herculean efforts are made to make sure you can't. I was amazed when I first learned this, but then it hit me. A hospital is no longer the community pillar I knew growing up, with its altruistic mission guiding its decisions. Hospitals have merged and transformed into giant corporations with little accountability, and they like it that way. Patients are encouraged to think that the healthcare system is a well-oiled machine, competent and all-wise. It's not. It's actually more like the Wild West. As a surgeon who has worked in some of the best medical centers in the nation, I can testify that American medicine is spectacular in many ways. Patients travel from all over the world to receive our state-of-the-art care. American research is the envy of the world. Yet this same medical system routinely leaves surgical sponges inside patients, amputates the wrong limbs, and tolerates the overdosing of children because of sloppy handwriting. In 2010, a Harvard study published in the prestigious New England Journal of Medicine reported a finding well known to medical professionals. As many as 25% of all patients are harmed by medical mistakes. What's even less known to the public is that over the past 10 years, error rates have not come down, despite numerous efforts to make medical care safer. Medical mistakes are but one costly example of how healthcare's closed-door culture feeds complacency about its problems. Years after completing my medical training, I encountered one of my favorite public health professors, Harvard surgeon Dr. Lucian Leap, at a national surgeons conference. He opened the gathering's keynote speech by looking out over the audience of thousands and asking the doctors to raise your hand if you know of a physician you work with who should not be practicing because he or she is dangerous. Every hand went up. Incredulous at this response, I took to asking the same question whenever I spoke at conferences, and I always got the same response. Every doctor knows about this problem, but few talk about it. Every day, people are injured or killed by a medical mistake that might have been prevented with a modicum of adherence to standardized guidelines. The silence about the problem has paralyzed efforts to address it, until now. Medicine is its own culture. It has its own language, ethos, and code of justice. How a doctor approaches a patient's problem, and whether he or she takes care of it or refers it to another more specialized doctor, depends to a large extent on their institution's workplace culture. At some medical centers, profits are king, while at other places, teamwork is a core value. Doctors swear to do no harm, but on the job, they soon absorb another unspoken rule: to overlook malpractice in their colleagues. Doctors are generally well-intentioned, self-disciplined, and well-trained. Most medical school applicants would detest a